Hello everyone, I'm Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member, and in this segment I'm going to be going over a poster that I presented at the American Public Health Association. It was with great honor that I was able to do this. There was a competitive process that many abstracts were considered, and I was one of the individuals that was selected for this. So let's go ahead and get started. The topic for this, of course, is food insecurity. The title of this is Food Insecurity and Cardiovascular Mortality Among African Americans with Obesity. So the sampling frame here is not the general population, but individuals that already have obesity, African Americans. And so among these individuals, if there was an increase in food insecurity, in cardiovascular mortality, if they had food insecurity. So that's the premise behind why this was there. And food insecurity is an area that I've been working for about 5 years with my collaborators. Some of the collaborators are actually included here. So I actually did not work on this on my own. There were multiple collaborators here, and they took on parts of this, and we were able to synthesize and create this poster. So I'm gonna give thanks to all of my collaborators and list them. So my second author was Andy Elliott. Third author was Dr. Joseph McMillan. Fourth author was Dr. William Bennett. Then Zine Nazar, Dr. Jagdish Kupchandani, Dr. Rafael Gonzalez Lagos, and Dr. Pat Dunn. And these individuals actually, some of them are graduates, some of them are current students, and some of them work in various organizations all across the country in the area of public health. So the main premise behind this, of course, is food insecurity, but very important to note is that people that are of minority status, of people of color, they experience food insecurity at higher rates than the general population. So what I'm going to do is zoom into these areas so that you can see. So minority households with young children face significantly higher rates of food insecurity. At the same time, obesity is a significant risk factor for various cardiovascular diseases. So, bringing these together, obesity and food insecurity really has deleterious effects on people, on communities. Something important to note is that disparities, ethnic disparities, social disparities, actually lead to physical conditions and maladies such as cardiovascular disease and mortality. There's multiple social determinants of health, of course. One of the five domains, economic stability. Food insecurity falls under economic stability. There's already observed associations between food insecurity, obesity, and cardiovascular disease, but to longitudinally prove through a model that this is actually leading to cardiovascular mortality in approximately a decade. That is novel. So Seligman is probably one of the foremost authorities in food insecurity, and he said that there was actually Hillary Seligman. She said that that food insecurity was correlated 32% rise in cardiovascular disease risk, and this was the most notable among African Americans. So this is a visual that was created by one of my students. So if you look at if you look at some of the interactions here, the group organization interacts with the community population, and various components. So these are all actually provided here in more detail to be able to take a look at what is going on here. So in community population, you have stigma, you have food insecurity, you have supplemental nutrition, and unemployment. So these are community level factors of food insecurity. And then you have, and I know the color coding is difficult to see, but the the additional portion, the yellow, is the individual, and I think we know what the individual relates to. And then peer support, cultural norms, interagency collaboration. These are areas that are determined by the group organization. So these three components come together to be able to understand better food insecurity. So addressing food insecurity and health impacts requires comprehensive strategies like considering migration, family dynamics, economic pressures, alongside with equitable interventions to mitigate cardiovascular risk factors. So as you can see, there's actually risk factors that have been determined for cardiovascular disease, but usually this hasn't been extrapolated to looking longitudinally. So that was what we did, and there's some more research on Robinson revealing that about 20% of black households experience food insecurity compared with only 10% white individuals. CDC revealed that the prevalence of obesity among non-Hispanic black adults was 44.8% compared to 35.6% among non-Hispanic whites. So there's different places. The SNAP benefits, of course, and the polarities of democracy are there to, and I had a conversation with Dr. Bill Benet on this. The polarities to manage are justice and due process, and then diversity and equality. And actually, all of the pairs are important, but food justice, brought on through the nutrition, affordable and culturally appropriate food through due process of codified law, such as the SNAP benefits. This actually made sense. So the codification of law, and so food justice is a type of justice, and so equality, so justice versus due process can be applied there. Healthcare professionals should be made aware of racial gaps, and I'm going to make that clear in a moment here. Basically, what we looked at in this study was that looked at National Health and Nutrition Examination Survey between the years of 1999 and 2010, and then followed up through December 31, 2019. Of course, we used the USDA questionnaire for the food insecurity designation, and then also observed cardiovascular disease mortality from actual ICD-9 codes that were translated to that. So these individuals were 20 years older or higher. And then, of course, there are multiple variables that were defined. So I'm not going to go into too much detail, but here were the findings. So taking a look at some of the findings here, of course, among males, the rates of cardiovascular mortality among those with obesity, males were higher than females in terms of how they experienced that. So looking at obesity, of course, we know that obesity already causes increased mortality. For some reason, this wasn't statistically significant yet. 24% higher among people that were obese, leading to cardiovascular mortality, and that makes sense. But when you're combining food insecurity, people that were not food insecurity didn't quite have a statistically significant higher relationship with mortality. However, when you combine, this is important, when you combine obesity and food insecurity, then you actually have a 163% increased likelihood of cardiovascular mortality versus no significance when you only have obesity and not food insecurity. So interesting to take a look at and digest here. So people with both food insecurity and obesity were 2.6 times higher to experience cardiovascular mortality than those without either of the condition or only one of the conditions. So numerous socioeconomic determinants of health needs to be considered, including neighborhood circumstances, social and community context, and access to healthcare. Prevalence of obesity is alarmingly high among African Americans, further compounding their risk for obesity. So this is something that should be screened for food insecurity and included, especially among minorities and communities of color. So this is important, and I think future research needs to look at how food insecurity can lead to increased stress, poor mental health, and adverse health behaviors. If you're interested in some research on this, you can look at some of my previous research, one of which has been cited about 100 times, and that is quite a lot. So take a look at some of my research. You can take a look at that in Google Scholar. You can also take a look at my channel and subscribe to my YouTube channel. I hope this has made some sense. Thank you for listening.